Hi. Hello, how are you? Good. My name is Lee and I'm the one that's going to be taking you back today for looks like your first visit. All right. Well, thank you so much for filling out your new patient paperwork. Let me set that aside here. I do just want to start up your chart in the system, ask you a few questions, just so we can make sure that this visit goes nice and smoothly for you. So it looks like you are a teenager. Yeah. Yes, we do see people younger than the age of 21, absolutely. It looks like you're just here to establish care, kind of meet a new gynecologist. Yes, so today, if you are open to it, we can do your annual examination. And an annual exam for a teenager can look a little bit different than maybe if you were older. Annuals at the OBGYN normally consist of 3 parts: a breast, abdominal, and pelvic exam. Now, with some of our younger girls or maybe individuals who may or may not be sexually active, they may decline a pelvic exam. Pap smears or that cervical cancer screen where many people end up having their first pelvic exams, those don't start until the age of 21. You didn't really want to do a pelvic today? That's okay. So for your yearly then, it'll be a breast and abdominal exam. And are you currently sexually active or have you been before? Okay. And then the provider will counsel you just on safe sex practices, and then we could even send out, STI screening as well for you without doing a pelvic exam through your urine. And we can always go more in depth about what those tests are when you see the provider. Okay, good to know. So I will make mention that there will be no pelvic today. Any medical conditions that you have that we should be aware of? I did see that you put no, but I just need to confirm. And are you taking any medications or supplements? Just a multivitamin? Okay. All right. In a relationship. Okay. Male or female partner? Okay. Do you use any methods of birth control right now, whether it be barrier methods, non-hormonal, other non-hormonal or hormonal options? Okay. Have you ever been on birth control before, like prescribed birth control? Okay. And when was the first day of your last menstrual period? All right. And then, let's see here. And do you get your periods every month? Do you know how many days in between each period? Yeah, those apps come in handy. And how many days roughly do your cycles last? Are they super heavy or painful? Okay. All right. All right, so with that being said, I have all the information that I need for your online portal and chart. So what we're going to do, if it's okay with you, is I am just going to get your vital signs. This is just going to be a blood pressure as well as a temperature check. I'll give you a cup to leave some urine in the event that you and the provider decide that you do want to ever send it off for any types of tests, okay? Awesome. So we are going to start with your blood pressure first. Alright. I am going to place it on this arm over here. You do want to keep your feet flat. I'm just going to take a quick listen here, so don't mind me. just going to take the rest of the air out here. And then if you wouldn't mind just sliding your arm. There we go. All right. We are going to place this inside here. And the next thing is a temperature check. This is a sublingual temperature, so it's going to go right underneath your tongue, if that's okay. So let me just get everything that I need here. Alcohol swab, we'll prep that. All right. Any fever or chills today? Anyone at home or around you that is sick with COVID or influenza? Okay, so it's going to go underneath your tongue. Just gotta wait. It is a little rusty-dusty. All right, temperature looks good. Let me just take this off with a swab here to disinfect it. Back in. Let me just write down your vitals here. Do you know how tall you are? Okay. Perfect. All right, so let me kind of get you situated here. So for your annual, we won't be doing a pelvic exam, but we will be doing a breast and abdominal exam. For the breast exam, the provider's really just going to know for any abnormal skin changes, lumps, pain maybe that you're having. I have left a gown here for you to put on. You'll want the ties in the front so that we could do the breast exam. And then I'm also leaving you with a white drape here that you could put over your belly, and then we'll just do a thorough abdominal exam. I will make special mention that because this is an ASMR OBGYN clinic, a lot of steps are going to be added and exaggerated for relaxation purposes to ease your anxiety. So just know that at a standard practice, a lot of these steps probably wouldn't partake or happen. Forget the word I'm looking for, but does that make sense? Okay, perfect. So what I'm going to do is give you some privacy, and then Leanna, the PA, will be in to do your shortened annual examination. Awesome. I'll see you a little later. Coming in. Hello, hello. My name is Leanna, and I am the PA that's going to be doing your first annual exam. It looks like we have you doing just a breast and abdominal exam. You politely decline the pelvic. All right, not a problem at all. Now, the medical assistant was telling me that you are sexually active, and just to be on the safe side, you are okay with us sending your urine out for STI testing? Okay, yeah. Now that urine collection that you left us is going to be sent out for gonorrhea, chlamydia, and trichomonas. There's some thought that maybe the urine testing wasn't as maybe accurate as vaginal swab testing, but definitely a great alternative in the event that you don't want a pelvic exam. You're not having any concerns down below though, right? All right. Now, just so you know, there are additional STI testing screens that could be done, like blood work for hepatitis, syphilis, and HIV, things we don't necessarily screen off of urine samples. You don't have to get it today, but just something for you to be aware of, okay? Yeah, the primary reason we even recommend the urine test is what so many people don't even know is that you can acquire sexually transmitted infections like gonorrhea or chlamydia and have absolutely no symptoms. To be honest with you, most people I've diagnosed in the past were all individuals that we just did routine screens on, not necessarily people that were having active burning or discharge or anything like that. So I definitely think it's a great idea. We did check the vaccine website, and you are fully vaccinated for Gardasil, which is great, but just always remember to use protection, use barrier methods, just because there are types of things like viruses, for example, HPV, HSV, that you can acquire through sexual activity. Yep, outside of kind of the ones that everyone else knows about. So what we're gonna do, if it works for you, I'm just gonna sanitize here, and then I'm gonna put some gloves on, and we'll get started with the breast exam. Of course, at any point, you just let me know if you get too uncomfortable. For sure. Right. Just gonna put on this glove. This glove. Okay, and if it's okay with you, I am just gonna move your gown on this side here. We'll start one side at a time. First thing I'm going to be doing is just a general skin inspection to make sure I don't notice any skin changes. You haven't noticed, though, any skin changes, redness, flaking, nothing like that? Okay. Okay. The next thing I'm going to do is an exam with my gloves to make sure I don't feel any lumps. You let me know if anything causes you pain, of course. Yeah, no, it's been definitely a busy day in clinic today, but it's been great. Any pain here? Okay. And if you wouldn't mind lifting up your arm. Perfect. Do you do self-breast exams at all? Yeah, I can definitely give you more info on your way out. But that's good that you do it occasionally in the shower. That's great. Better than nothing. All right, this breast exam is complete. I'm going to cover you up there. Okay, and I'm just going to move this down over a little bit. Okay, same thing. Just going to take my pen light, do a skin inspection. Do the exam with my gloves again. Yeah, it's always good to do a self-breast exam standing up as well as lying down, because the tissue may shift where you feel things differently. Speaking on personal experience with myself, I think it's always a good idea. And then once a month, usually a week after your cycle, especially if you're someone that gets super swollen, tender breasts before the period. Sometimes people get like hormonal cystic changes for sure. Can you lift that arm for me? Okay, very good. Okay, you are all done with your breast exam. Next part is I'm just going to untie this section here for your abdominal exam, if that's okay with you. Alright. Yep, that should be fine as long as you're still comfortable. Good. And I'll kind of move this to make you feel a little bit more privacy. Alright, general abdominal exam with the light here. Okay, not seeing any skin changes down here, no signs of hernia. I'm just going to press on your abdomen here. Pain at all? Good. Press a little deeper here. Okay, good. Gonna do a little bit of percussion. abdominal exam appears completely normal. Are you having any urinary symptoms today? Like burning when you pee, peeing more often, back pain, anything like that? Good. Let me just tie this again for you. But other than that, your annual exam is completely done here today. You did great. It was better than you thought it would be. Absolutely, yeah. We completely go at your pace and what you're comfortable with. And then of course, you know, if we ever feel like an exam would be a lot more recommended, we will always kind of advise you the best we can, but ultimately at the end of the day, it's your decision. So at checkout, the girls will give you some patient education on self-breast exams, some information regarding Gardasil and safe sex practices to help prevent risk for things like cervical cancer. I'll give you some info on birth control in the event that you're ever interested in discussing that further with us. And then of course, you know, now you are established here. If you ever have concerns from down below and ever need me to examine you, please just let me know. Otherwise, pap smears for you will start at the age of 21. I will send this urine sample off to the lab to screen for the STIs that we spoke about earlier. And of course, I will call you if anything is positive and will counsel you appropriately. It is not a problem at all. It was super nice meeting you. I hope you have a good day. I'll give you some privacy to get dressed. You can leave everything on the medical table when you're done. And then the girls will see you at checkout. Have a good day.